So earlier this week, we examined Quinault's exercises in style, in which he uses multiple different stylistic choices to tell one story over and over again. I really like the Quinault. One of the things that I think this work really demonstrates is the idea that stylistic choice is a very conscious choice on the part of authors. And it's something that which we as readers can and should identify. And in addition, it suggests that stylistic choices can change the way in which readers understand or in the way that they can interpret a story. Now, while we focused on multiple different stylistic choices with Quinault, now I want to focus on one given stylistic choice in our reading of Susan Sontag's The Way We Live Now. And that stylistic choice is voice. Before we get started with talking about voice, I want to give you some background on Sontag and on the story that we're reading. So Susan Sontag was born in 1933 and she died in 2004. She was a prolific and extremely well-known public intellectual and writer. The Way We Live Now is a short story that was published in The New Yorker in 1986, and it comments on the AIDS epidemic in the 1980s. It was beginning to affect New York City's cultural elites. Now, a bit of background, because what Sontag is doing is capturing a moment in the long history of AIDS and a very early moment of AIDS progression within the U.S. So, AIDS obviously has a long history. It's worth it to begin to look at that history for just a minute. First of all, first see AIDS mentioned in the United States in a CDC report in 1981. That report talks about AIDS as a rare form of cancer that's found among gay men living in Los Angeles. After that, more cases begin to appear in the United States. And at this point in the early 1980s, the prevalence of AIDS in the US is largely confined to homosexual and drug using communities in coastal cities like San Francisco, Los Angeles, and New York City. By 1983, the CDC had clarified what the route of transmission was for AIDS. And in so doing, they were able to explain that AIDS cannot be transmitted through casual contact. So by 1986, the year that Sontag's story is published, there's been a couple of things that have happened. One, the cause of AIDS has been identified as HIV. Two, Congress had begun to allocate money for AIDS research. And three, at least one hospital in California had opened a ward specifically to treat patients who had AIDS. But despite those measures forward, the disease itself was not all that well known in 1986, and there was certainly not a robust treatment protocol like what we have now. So a few things about this story. The story itself is structured around a series of conversations that are taking place among a group of friends about a member of their friend group who has become sick and is in and out of the hospital. The friend at the center of that story never actually speaks, at least not in the present tense. And his friends never actually mention that he has AIDS or HIV, but they allude to it constantly. And his friends use his illness as a jumping off point for gossip, prognostications, bickering, and commentary about their knowledge of the disease and their opinions about the medical establishment's treatment of it. So here's a few things that I want to discuss. One, how does Sontag weave these different voices together? Are they fragments of conversations that she's picking apart? Or is she giving us a series of more fully developed conversations and then just sort of stitching them into a story? Two, why does Sontag choose to narrate this story through so many different voices, none of which is the actual patient? What does that suggest about the events taking place in the story? And three, how does the author's stylistic choice to focus on voice allow us to understand the events that are occurring within this story? I look forward to discussing the story with you on the discussion board, and I'll see you there.